Ovarian cancer is often called the silent killer, which really annoys me because I'm sure it isn't. Is it silent?
I'm glad it annoys you because this is an absolute myth and something that we work really hard to stamp out. I mean, I've just spoken about the symptoms, so clearly there are symptoms. And this comes from research which shows us that the majority of women are experiencing symptoms in the months prior to their diagnosis. And something I want to be really clear on as well, because again, this is another myth that perpetuates, is that women with early stage disease experience these symptoms too. For many years, it was taught that only women with advanced stage disease experience symptoms or present with symptoms, and therefore there was nothing that we could do. That's not the case. Women with all stages of ovarian cancer are presenting with symptoms, so we have an opportunity. The problem is that people in the general population are not aware that the symptoms I've described can be associated with something like a cancer, so they don't discuss them with their GP. And from the GP or healthcare professional perspective, the symptoms can be very subtle in presentation. They may also, because of the age group we're thinking about, present with other comorbidities. And so it's really easy to attribute those to a benign condition like irritable bowel syndrome. It's a very common misdiagnosis. So what I would say to anyone listening to this is that please remember that irritable bowel syndrome is extremely uncommon as a new diagnosis in women over the age of 50. So if you are thinking IBS, then please just consider ovarian cancer. Do a CA125 test, do an ultrasound, get it ruled out before you proceed any further.
Could you just explain what is a CA125 test?
So a CA125 test is basically a blood test that should be available to all GPs practicing in the UK. So what that will do is it will give us an indication. It's not an absolute diagnostic. It measures the level of CA125 serum in the blood, and guidelines tell us that the normal level is 35 or below. So anything above 35, we would be maybe starting to think about potentially ovarian cancer, particularly in women over the age of 50. I mean, those people who are listening probably are aware of some of the caveats of CA125. It can be raised for other conditions, inflammatory conditions, other cancers, and also by things like endometriosis and menstruation. So there are caveats, but at the moment, it's the best tool we have in primary care to start us on the right pathway of diagnosing ovarian cancer.
Thanks, that's very helpful. Now, can women do anything to protect themselves to avoid ovarian cancer?
Ovarian cancer is a hard one to modify in terms of lifestyle factors. Like we know with some cancers, there's a very strong association between smoking and development of that cancer that obviously people can take steps to manage. It's not clear cut like that for ovarian cancer because the main risk factors are increase in age and a genetic predisposition. So the main things I would urge people to do are is first of all, knowledge. Knowledge is power. So know your own body, know what is normal for you, know the symptoms of ovarian cancer, and be aware when they start. If you do get something that you're concerned about, then take that knowledge, take that to your GP as soon as possible and report them. And if you are worried about ovarian cancer, then I would advise people to absolutely ask about it. Don't assume that your GP is going to necessarily think about that initially. I would ask about it if you are worried.
So what about screening? Can't we just screen for ovarian cancer?
Oh, I mean, we would love to have a screening program in our arsenal. No screening program is perfect. It's part of the approach to addressing early diagnosis. There have been some major clinical trials undertaken both in the UK and beyond to look at the screening tools and interventions to see if they have an impact on diagnosis and the most important outcome, which is mortality. That's always the end goal, reducing mortality. And unfortunately, at this point in time, those studies haven't shown to reduce mortality, although in some cases we did see some cancers being diagnosed at an earlier stage. So at the moment, there is nothing like that on the horizon. Obviously, there's new research going on all the time into different aspects of biomarkers and diagnostic tests. So we don't know what the future holds, but at the moment, that isn't something on our horizon.